in the beginning of the pandemic, the government reacted quite positively and quite quickly. The first case was recorded on the 12th of March, and by the 15th of March, the president had issued a nationwide lockdown and closed all of our borders.
He also said that you'd have to spend 14 days in a quarantine facility, and because he didn't specify, Kafura and I were really scared about whether we were gonna be let in. We boarded our half-empty plane and we came back to Kenya. We were very lucky to have been sent home early by the college. Our school took that step to shut it down and to send people home, and I'm so glad they did that early, because if they had not done that, some people would not be able to get back to our homes. Like, I know for sure I wouldn't be able to be here.
Kenya has been battling with increased police brutality during this time. I feel like you have to understand the political situation in Kenya. Before the coronavirus pandemic came to Kenya, there was already a lot of political instability in our country. Our president had his own personal interests and his own agendas that he was pushing for in parliament.
Here in Kenya, the government has introduced a policy that states if you're in any public space, you have to be wearing a mask. If not, you can and will be arrested, and you'll have to pay a fine of 20,000 Kenyan shillings, which is the equivalent of $200.
A curfew was announced. A lot of Kenyans did not take it as seriously as they should have, and because we didn't necessarily obey our government, they had to rely on police aggression. In the first 10 days of the curfew, the police killed 6 people and tortured many more. The nationwide curfew was from 7 p.m. to 5 a.m. and anybody found out after that time was beaten.
In fact, we've had more deaths from police officers than from corona itself since the pandemic started, which is honestly really alarming.
The police mainly targeted the people of low socioeconomic class. These are the people who have really suffered during this pandemic. The situation was even more horrific because the government demolished squatter houses in Kenya, a slum called Ruai, and left 15,000 people homeless. They are the most exposed and the most vulnerable to this disease, and the government decided that now was a good time to demolish 15,000 people's homes. The first case in one of these slums, Kibera, which is the largest slum in the world, was recorded quite early in the pandemic. The results are obviously botched because they told us that there's been 20 cases, and then a few days later there were 50 cases, and then all of a sudden they just stopped reporting news from this area. Our testing, our medical supplies, our doctors are quite limited, and so they completely just neglected these people. Back to why Kenyans don't trust our government.
We've had cases of police waiting for 7 p.m. just so that they can go to someone and beat them up and say that it's time for curfew. We don't really know how safe you are at the hands of our own police.
Our president has been pushing his own political agenda for the past month or so. He would like to get this referendum passed in the parliament. Actually, the truth is, this bill that he wants to pass is not even very clear to the ordinary Kenyan. We have no idea what he actually wants.
Another story that's really alarming of this police brutality in Kenya is the story of a 13-year-old boy who was shot dead a few minutes after curfew, back when the curfew was 7 p.m. and he wasn't even outside. The mom tells a story and she says that they were inside the house on the balcony, and before she could do anything at all, she just finds her son lying dead on the ground. He had been shot dead by the same police officer who was shining the light on them. There's a virus, and police should be the least of our worries. In fact, they should be the ones protecting us.
We received aid from World Bank, WHO, and Chinese businessman John Ma, a substantial amount of money to be redirected into building our healthcare system. The 3 biggest Kenyan hospitals where they have been referring COVID cases to is completely full. They have no more bed capacity to keep any more people, and we have only reached 3,000 cases. This is quite alarming. More than $30 million has been wired to offshore banks. Basically, $30 million that was given in aid has been put in the pockets of some powerful people in Kenya, which is it's so disheartening because of all of the things that are not happening, As of June 19th, 2020, there are 4,320 cases and 119 deaths. How have I been coping with lockdown? I kind of don't want to answer this question because it's very neglecting, if that makes sense. I acknowledge that I am privileged in Kenya, and my experience is not the experience of a lot of people in my country. I have very minimal contact, unlike many people in Kenya. I'm frustrated at my government for the things that they could be doing, but the things that they aren't. My experience of this virus is basically not important. That's the truth, because there's people who are going through shit during this time. I'm sad, I'm bored, I can come here and say all those things, but that's basically nothing compared to the actual strife and struggle that people are going through in my country. Pollution in our country has immensely decreased, but I struggle to find something that I actually think is a positive from this virus.
I'd really like us to take care of our mental health. Just take a step back, relax, do something you like, read a book, and now that school is done, you don't have that extra stress on you. Just take some time off and, just be happy, focus on your mental health.
On the 1st of June, there have been 645 deaths due to corona in South Africa. I think the situation reached its worst point once we had been in strict lockdown for about 2.5 months, and our government simply wasn't letting up. All politicians, economists, and scientists agreed that at this point the lockdown was hurting more than it was helping, but our government would not listen. Our economy was crashing, the amount of homeless and unemployed absolutely soared, and many people couldn't afford to stay at home any longer. On top of that, we still had many random nonsensical rules, like we were only allowed to exercise between 6 a.m. and 9 a.m. in the morning. Originally, we had a 2-week very strict lockdown, when we were only allowed to leave the house if we were an essential worker or if we were going shopping or going to the hospital. Then lockdown was extended, and a phase of relaxation was planned, but the government never provided any justification for its actions. The military has been deployed, the biggest military deployment since Nelson Mandela was elected president after apartheid. But unfortunately, there have been many reports of police and military brutality. Citizens have been beaten in broad daylight, and children have been wrestled from the arms of their parents for petty infractions, and it has been reported that 50 people have died because of the actions of or in the custody of the army and the police. And there are also huge fines for breaking lockdown rules. South Africa unfortunately had quite a few disadvantages when it came to their response. We have many unemployed people, homeless people, and people who live from paycheck to paycheck, so many people could not afford to stay at home. We also have many informal settlements in South Africa, and often in informal settlements people share things like toilets and water points, and so for them social distancing is impossible. There are also many people in South Africa who have diseases like HIV and TB, and this firstly means that they have weaker immune systems or lungs, but it also means that they often have to queue with many people to get their medication. I miss so much about life before Corona. I miss my freedom, I miss my friends, I miss the hum of people around me in a cafe, I miss being able to get to know strangers, and of course I miss AC a lot. As soon as lockdown loosens for a second in South Africa, I'm getting on the first plane I can to Wales or anywhere I can get near Wales in case something goes wrong in South Africa again and they cancel international flights. I think one of the positives for South Africa that has come out of this situation is that it has shone a light on what a mess our leading political party is, and maybe it will help people vote better in the next election. Listen, this sucks, but the one way I've found to improve my mental health is to help others. So find a way you can support your community or help out your friends and family, and that way you help yourself while helping others.
Hello, my name is Akomalafe, and I shall be telling you about the COVID-19 situation in my country, Nigeria. So far, we have had 549 deaths. There are currently 22,000 active cases, and 76,000 people have recovered. Although we've only tested 112,000 people out of a population of 196 million, where the government had promised to test 2 million people by the end of June. These statistics don't provide any sort of accurate representation of what we're actually going through. Fortunately for Nigeria, the average age is 18 years old, which puts most of the population out of the age that is at risk. Although, we still have 2.7% of our population above the age of 65, which means that 5.3 million people are still very much at risk of dying from the coronavirus. In terms of restrictions put in place, on the 30th of March, our president announced a lockdown in 3 cities. So Abuja, FCT, the capital, Lagos, the largest city in Nigeria and also the largest city in Africa, and Ogun State, which is a region nearby Lagos, where there's a lot of travel between the two regions. So this lockdown meant only essential services such as food and food delivery systems were allowed to keep operating. So the lockdown was enforced by the police. There was police brutality quite frequently. And a lot of the population felt trapped because the informal sector, in which more than 80% of Nigerians work, includes a wide range of occupations from street traders, taxi drivers, tradesmen, and artisans to food vendors and hairdressers. In Lagos alone, according to research by non-governmental organizations, 65% of the estimated 25 million people work in the informal sector. Informal workers have lower incomes, often do not have savings, health insurance, or pensions that provide a basic social safety net, and 72% of them are poor. So when the president introduced the lockdown, it meant that for 80% of Nigerians, they wouldn't have their daily income for a month. The sentiment of death by COVID or death by starvation was spread around. And aside from donations and, just raising awareness of my friends, I felt very powerless. One of my neighbors is a tailor, and he had to leave his house, and he said that he was going to go and live in his shop for a while when the lockdown started, because he knew that he couldn't afford to, miss out on the daily income. And he'd rather be in his shop and complete some of his past jobs than to be idle at home. And I think that was a decision that a lot of people had to make during this period, because they simply could not afford to waste that amount of time, especially when you're earning on a day-to-day basis. There have been stories going around about how if you go to the hospital for whatever reason, they could either A, reject you if you don't have coronavirus, or take you in no matter what you have and announce that you have coronavirus. And you're likely to get infected in the hospital anyways. And this is quite worrying for the population that might have legitimate health concerns but are now discouraged to seek help, because they feel like going to the hospital is a death sentence in and of itself. Among the dead was Abakari, who was the president's trusted chief of staff, and due to complications of this disease, he died at the age of 67. I would say one thing that this virus has definitely done, in my view, is bring about a shared sense of humanity through a sense of mortality, if that makes sense. Nigeria is one of the most unequal countries in the world, and somehow this virus has seemed to even out the stakes. No matter how rich or poor you are, there is no amount of money that can save you from your death. I think the environment benefited a lot. There were definitely a lot less cars on the road, which meant a lot less CO2 emissions. However, in terms of the economy, because Nigeria's economy is mostly based on oil exports, the whole situation has had very adverse effects. The price of a barrel of oil in the past dropped below zero, so I'm very worried about how this will play out. But my optimistic view is that perhaps the true leaders that Nigeria needs, the ones who are committed to solving issues and actually lifting Nigerians out of poverty and building a real economy that's diversified, will come out of this situation, because the oil money will essentially finish. For me, the coronavirus unfortunately meant that I had to leave my family in Wales, and this was quite tough because it is quite difficult to maintain intimate connections with people over such a great distance, although I would say I'm very thankful that social media and the internet have been such a blessing in keeping us connected. Looking forward to see everyone again when we return, if we return. I hope we return. One thing that has been good about this whole period globally is I feel like there's a lot more art in the world. If I had a message for the world today, it would be okay, so take a look at what happens when the world faces global threats. We had a very short time to prepare for the coronavirus, and yet some leaders acted very swiftly, very decisively, based on the evidence and based on the facts, whilst other leaders pretended it didn't exist. They ignored it for political reasons, amongst others. And if we look at other world problems that aren't as drastic as the coronavirus, but exist nonetheless and may have even more harmful consequences, such as global warming, we have evidence to back these things up. We know what we should be doing, and yet we're not doing it for whatever reason. I think it would be wise to learn. Anyways, stay safe, have a fantastic summer, and my love to everyone watching this.